This video guides you how to do pre-procedure CT planning using the Redo TAV app for cases where index TAV is SAPIEN or SAPIEN XT and second TAV is SAPIEN XT or MyVal. When you click Redo TAV CT planning on the home screen, first you will get the overview of all steps you need to do. The CT acquisition protocol can be the same with routine pre-TAV assessment. It's recommended to obtain an ECG-gated multiphasic function CT that covers the entire cardiac cycle, with ideally 20 phases, a minimum of 10 phases. The mid-diastolic phase generally has fewer artifacts, allowing for better assessment of the process reflex and commission alignment in most patients. The end systolic or end diastolic phases could be used as alternatives. The first step is index TAV and measurement. If a pre-index TAV CT data is available, select native valve morphology and the severity of calcification, and identify your patient index TAV type and size. And then you will get the fundamental information of the valve. A leaflet of SAPIEN XT will extend to the top of the stent frame when it's pinned out by a second TAV. So the top of the stent frame is the reference level for index SAPIEN XT. On the next page, select the index TAV failure mechanism and assess commission alignment. Open your patient's CT dataset on a CT software. We can use any CT software. We just need 3D MPR, multi-planner reconstruction model. After determining the appropriate cardiac base, align the MPR to be orthogonal to the valve. And assess commission alignment, which refers to the relations between the native aortic valve commissure and THV commissure TAV. The commissure offset is directly measured using an angle tool with the limbs aligned with THV commissure and the native commissure of RCC and LCC. For this case, the angle is 32 degrees, so moderate misalignment. And perform the measurement of area and perimeter. This measurement will be used for second TAV sizing later. We can also understand how much the index TAV is underexpanded at this point. For SAPIEN XT, 3 levels require assessment: outflow, mid, inflow. Here is the outflow level, making sure the MPR is precisely orthogonal to the valve, and measure the area by tracing the center of the stent frame because of less blooming artifact. Adjusting the tracing if needed. And you get the area and the perimeter at this level, and move to the mid-level next. Do the same measurement at this level, again tracing the center of the stent frame. And get the area and the perimeter at this level, and move to the inflow level. Again, do the same, tracing the center of the stent frame. After or during the measurement, please fill in the areas and perimeter you measure in the app. Step 2 is identify your patient coronary risk plane, which is defined as the lowest level of coronaries in relation to the SAPIEN XT reference level. On the CT, scroll down the plane from the top, and first you can see the bottom of RCA and then LCA in this case. And this lowest level of coronaries is above the top of the stent frame of SAPIEN XT. In the app, you select the bottom of RCA and LCA levels, and then the CRP level will be automatically identified. In this case, the CRP coronary risk frame is above the top of the stent frame. At the step 3, once you select a second TAV, you will get an idea about ideal or acceptable level of neoskirt frame, NSP, which is defined as the top of the neoskirt. For MyVal in SAPIEN XT, it is a single level at the top of the SAPIEN XT stent frame. For SAPIEN 3 in SAPIEN XT, it is the same, the top of the stent frame. For this combination, we have only one selection for the neoskirt frame level. And this level, top of the stent frame, is below the coronary risk frame, the lowest level of coronaries of this case. Therefore, the risk to coronary is considered as low in this case. The next step is in vivo CT sizing. We already measured the areas and perimeters at the 3 levels at step 1. On the app, the 3 levels will be automatically selected, so please make sure the numbers are correct. And if you would like to, check the button of Include Perimeter and click the Calculate button. Then you will get calculated average area, perimeter, area driver diameter, perimeter driver diameter. The app cannot suggest sizing at this point due to the FDA regulation, so you will need to choose a second TAV size based on your CT measurement. Here has some guide how to choose size, and here you can also get IFU table too. For this case, I will choose size 26 SAPIEN 3 and move to step 6. As I mentioned before, this case has the top of the neoskirt NSP is below coronary risk frame, the lowest coronary level, so risk to coronary is considered as low, so no need further VTA assessment. At step 7, you will get summary reports of 3 pages, which include animation representing the relationship between the neoskirt frame and both coronaries. You can take screenshot and also import this report into CT software summary report like we mentioned. If available, the information of pre-index TAV CT can be gathered at step 8. For the case of neoskirt frame above coronary risk frame, which is less likely due to short frame of SAPIEN XT, please refer to SAPIEN 3 section. This is all steps you need for pre-Redo TAV CT planning. I hope it helps you. Thank you.